Hi, my name is Havy Mannion, and I am the U.S. Sales Manager for Foresight. Today, I want to give you some information about our products. I like to start with my why. Why am I passionate about Foresight? It's because of Cuba and Rooney. Cuba is a horse that I compete on. He was getting injected every 3 to 4 months. He's been on the product for 1.5 years, and he has been injected once. Rooney is my dog, loves to swim, loves to fetch, loves to get on and off the couch. She got to where she wasn't doing any of that anymore. After 1.5 weeks on the product, I found her in the swimming pool, and she's back loving life. So what is Foresight? We're based out of Australia. We are owned by Dan and Karina Bright. We are globally distributed. We have been in the U.S. for a little over 3 years. So what is the why for Dan and Karina? It's Sasha. Sasha got to where she wasn't enjoying life. She was suffering with osteoarthritis. So they came up with a product to try to help her. Let me give you a little more information about it. So the original product, like I mentioned, is Sasha's Blend in 2000. The original product had marine components and Epitalis in it. I will go through with you the transition to where we got to the product that we sell today, which is only Epitalis. So some stats on osteoarthritis. It's one of the top 3 most common reasons for elective euthanasia. Dogs will start showing signs even at the age of 1. 80% of dogs will start showing signs at the age of 8. Cats, our horses, that is 60% of our horses' lameness is attributed to osteoarthritis. So we have a small window of opportunity to reduce the risk or the progression of the disease. So today, our pets are living longer. We're competing on our horses longer. This is all great. However, we are seeing the effects of osteoarthritis more. So what do we do? When a vet is doing a diagnosis and trying to figure out a successful osteoarthritis management program, they may tell you things like this. The hidden progression of the disease itself. So if you think about your horse, in their leg, they're going to have blood flowing up and down their leg. But where the problem arises is when you get to the joints and you get to the synovial membrane and it starts degrading. And the blood starts going in the joint itself, getting in that synovial fluid and the breakdown of the synovial membrane. So our product actually targets the membrane and the fluid to help keep a healthy joint. So there are a ton of oral joint supplements out there. How do you decide which one to use? Do they have a body of evidence? Are they easy to give? What's the cost per dose? Are there side effects? Is it safe for long-term use? I'm going to go over all of that with you in this presentation. So our products that I'm going to go over are going to be our human product, which is EpiJoint, our dog, and our horse. So one of the key things with our product is it can be used as a standalone or in conjunction with an NSAID. Epitalis, what is it? It is a plant seed oil that in its raw state is a triglyceride. We have a proprietary process that we change that into a fatty acid, which makes our product have mucosal absorption. When you give our product to your horse or your dog, as soon as it gets into their mouth, it starts absorbing into the mucous membranes throughout the body. So I'm going to do some of the high points of our studies for you. In 2008, we did an in vitro study. Now, I had mentioned earlier that our original product had marine and Epitalis. So in this first study, what we did is we wanted to break those up, see exactly what was doing what. So we did the marine products, which was New Zealand greenlet mussel, abalone, and marine cartilage. And then we took the Epitalis. And then we did NSAID standalone because we wanted to see how are our products comparing to that. And this is what we found. So the marine products were equivalent to the anti-inflammatory properties of the NSAID, but they had no effect on the chondrocytes, which is the cells to the cartilage. Didn't help them, didn't hurt them. Then the NSAID, when we looked at it, it had great anti-inflammatory properties, which we already knew. However, the chondrocytes started dying in 48 hours. So the cell to the cartilage was dying. The Epitalis, we found that it was equivalent to the marine and the NSAID in 48 hours as far as the anti-inflammatory properties. And we saw chondrocyte proliferation. The cells to the cartilage actually started growing. So it was at that time that Dan and Karina decided, hey, we don't need the marine products anymore. We're just going to have Epitalis in our product. In 2022, we did an in vivo study with 46 dogs. We used the objective data from the Gatorite. We used subjective data from the Helsinki. So here's where I will refer back to Rooney. So with the Gatorite, we took these dogs on day 0 and on day 30 and we walked them up and down this mat on a leash. In this particular dog, the hind left is where it was sore. Front right is where it was overcompensating. Then the quality of life score, the Helsinki, like Rooney. Was the dog swimming? Was it getting on and off the couch? Was it playing fetch? So the owners did this at day 0 and at day 30. And this is what we found. Out of the 46 dogs, all of them saw improvement, 94%, in the total pressure index and the Helsinki. But what was really cool was 71% of the dogs on concurrent OA medication recorded improvement in both the total pressure index and the Helsinki. That was a very great find for us. So the in vivo study that we did in 2022, this one was done on horses. This was done by Dr. Wayne McElraith out of Colorado State University. The investigators feel that this is some of the most compelling evidence of therapeutic effects that have been seen with an oral supplement using this model. So the model we used is called the carpal chip model. We took 16 horses and we surgically induced osteoarthritis. 8 of them were then put on placebo. 8 of them were put on Foresight. We controlled everything in these horses. Their exercise, their feed, all of it. And this is what we found. So if I refer back to Cuba, Cuba was getting injected. He was living on NSAIDs. He also lived on Gastrogard because he had ulcers from the NSAIDs because they depleted something called PGE2, which is found in the synovial fluid of your horse or your dog. Our product will lower the PGE2, but it will normalize it and take it to baseline after 5 weeks. So the horses and the dogs need it. They don't need elevated of it, but they do need it. We don't need it to deplete it. So our product does not cause ulcers. White blood cell count. Rooney and Cuba had elevated white blood cell counts because they had inflammation throughout their body. We were able to lower that. You can see the placebo versus the Epitalus. And then the mark radiographic changes. You can see here the carpal chip, orange arrow. White arrow, you can see the inflammation. Day 70, orange arrow. Where's that carpal chip? The white arrow, you can see that the inflammation is significantly reduced. So it was at this time that we were able to see disease-modifying activity. We are actually able to slow the progression of osteoarthritis. So our product range, our dog product, it is a cream flavor. It is a gel, comes with a syringe. It's a small daily volume. It's actually 1/2 ml per 22 pounds. It is mucosal absorption, as I mentioned earlier. You can use it for acute joint injury or treatment of moderate to severe OA. With the dog product, there is not a loading dose. It is just based off of their weight. It comes in 3 different pack sizes. We have a 50 ml, 100 ml, 200 ml. Our horse product comes in 2 pack sizes. You have the 250 ml, which will last a horse about 2 months. You have the liter, which will last the horse about 8 months. You have the syringe. You do give it to them directly by mouth. Our package instructions are based off of about a 1,300-pound horse. With this, you will give a loading dose of 8 mils. If they are experiencing effects of osteoarthritis, you'll do that for 2 weeks, and then you will take that down to 4 mils. It does break down to 1 mil per 330 pounds if you have a larger horse or a smaller horse. This product is apple flavored versus the dog product being the cream flavored. It does come with a 12 mil syringe. It is not a standard syringe. If you need more, we can give you more. Our shelf life is 3 years from the manufacturer date. EpiJoint. So I take EpiJoint. I have a failed back surgery. I have also been nerved. And I was getting injected as much as Cuba was. I've been on the product for over a year. I have not been injected, and I am not taking all of the pain meds that I was taking. So this product, we've done a lot of clinical studies. I won't go into too much detail on this one, but Dr. Peter Mitchell did our studies. You can see like 83% quality of life score. You know, I love to compete on my horse. I don't hurt anymore. I can get up and down from a chair and I don't hurt. And you can see all of the other results. This is just an overview of Peter Mitchell's study. It comes in 2 different pack sizes. We have 60 and 120. The 60 capsule will last you a month. The 120 capsule will last you 2 months. This product is available on Amazon. We do guarantee our product efficacy and palatability. So just an overview, we are the only product that you will have Epitalus in. We do have a patent on it. We have 25 years of world-class research. We are endorsed by vets and surgeons. We guarantee our product palatability and efficacy. It is a small, cost-effective, daily volume product. For a dog, it'll be at retail pricing, little over $1 a day. For a horse, it'll be a little over $1.60 a day. Thank you so much for your time today. If you do have any additional questions, please feel free to contact me on my cell phone or via email. Thank you.